Good afternoon, colleagues and partners. Thank you, Agora, for this opportunity. I'm in medical tourism since 2014 and working with all sorts of medical specialties with many countries, many regions, European region, African region, Asia, and then go on to Latin America, all those countries we are working with. We have network of partners, more than 500, bigger brands of hospitals, more than 25 plus countries we are operating in. And we are growing very fast. This is my second company. The second company within 4 years has crossed many others who were in this field for many years, just because we introduced different innovations, which we are going to discuss today as well, because we see the rise of AI, and this will change. It's going to be a game changer for everyone. So even the newcomers can come on and dominate the old players. And I think we should all be excited for this moment in time.
And the second question is, Dr. Zishan, the AI is transforming healthcare. From diagnostic to treatment to hospital operation and billing. Which AI app are having the biggest impact now?
So it has effect on all stages of patient journey, starting from diagnostic, treatment planning. Then if we talk about the most exciting part, which is the preventive medicine, there's a lot of research going on. I came across one of the articles when I was clearing some material that Red found that they have AI foundation model. They published the research on basis of more than 6 million patients, where they did the retinal scans through and AI optics, and they found that we can basically predict a clinical onset of Parkinson 7 years in advance. So we can basically 7 years before the clinical onset of this disease. So this is something where humanity can have hope that many diseases can be prevented. This is just one of the example. Along with Parkinson, with the same kind of AI foundation model, they can detect the macular degeneration, they can detect the cataract in advance, they can detect some conditions like glaucoma, so all related to ophthalmology conditions, some neurological condition, it can be detected with quite high accuracy. So this is something we should be excited about. If we talk about diagnostics, I think most of the hospitals have started using the teleradiology. It's much more easy for them now to send, to just first to the AI models and get some interpretation based on the images. You see these, you have the hundreds of images, which is literally difficult for a human eye to spot the minor changes, for radiologists. So it will decrease an immense amount of load on the radiologists, and the interpretation can be quite correct with the help of AI. The end of the day, the conclusion is from the radiologist, but with AI help, it can be, much more accurate. Then if we talk about the treatment, then there is, the treatment planning. So we used to do that as doctors, you see, they are doing it just a normal kind of manual calculations based on the body weight and height of patient, all the dosages, etc. But now you have AI tools, and basically with the patient data on your registry, it can give you more accurate understanding of what should be the medication and other requirements. I see a lot of our partnering hospitals. Even I had consultation with one of our nice colleague, Monica. She's the presenter of Kiran Salute Group. So they are actively using now the dermatoscopy. It's people like, we know that skin cancer and skin conditions are a lot. To prevent skin cancers or any malignant conditions, they can have just an appointment with a nurse. You don't need an appointment with a dermatologist. You can just go to a nurse, take a picture of the skin lesion, send it through app to the doctor. It might give you already an idea about what condition is it. Is it something concerning, or is it just just a spot, just a mole? If it is something concerning, it will plan an appointment for you with the doctor, and you can go and do some biopsy and other tests. But if it's not, then basically you don't need to put a burden on extra appointments for the hospital and scheduling. So these are exciting times. We see the queues will decrease, the load time, the rescheduling, the admission times, everything will be impacted with the use of these AI technologies.
I think AI can help us, can guide us, and so we can have more time for patients.
Yeah, and one more thing I'll add, this is also very commonly used, it's called ambient listening. Danish just pointed out that they mentioned one device which can give you some kind of interpretation during the consultation process. So I see it's being used in hospitals already. So between patient and doctor, you don't need to have a translator there or an assistant. You can just put a laptop there, turn on the program, and it will basically record all the conversation. It will create a transcript of it, it will translate it for you, and it can cross-match with the patient database as well. So you don't have to manually write. I mean, as a doctor, when we were going through our medical school, the problem was, the most boring thing was to write medical history. I know every doctor has the same pen. So to write medical history, it's a boring process, and it depends, it has a lot of human errors as well. So now with AI, you have a single database which is going to be, with click of a button in front of you, and which will be cross-matching all the previous results and stuff. So this is very exciting.
We have this system in our clinic, and after conversation with patients, we have a letter for the patients in the treatment and a summary without writing. This is amazing. Second question, Dr. Zishan, is where do you see AI delivering the strongest return to investment? Cutting administrative overhead, reducing readmission, and how are you tracking the benefits?
So I mean, it will bring changes in all these areas. Of course, cutting costs, reducing human workload, the human resources will be reduced. I'll just give an example of what we are doing. So basically, the future of AI is in the personalization. So that should be the main focus. Now, it is in very raw format. We see ChatGPT, we see many other tools being used, but the accuracy based on your search isn't there. It is giving you just a generalized answer based on what it has researched, what it has gathered. But what you need specifically, it's different. So what we are doing now, I'll just give an example into that regards. Let's say we have a medical coordinator. Is kind of, we have a different business model where we trained doctors to be working as medical coordinators. So every doctor has a certain strength and weakness. Strength in a sense that, okay, he may know a few languages, like let's say English, Russian, Ukrainian, some Arabic, etc. He may know certain medical specialties, let's say neurosurgery, oncology, and some other areas where we see, their conversion is good, we see the response is good, we see their, other parameters in that regards. So for that, what we do is that if a client has reached to your platform, then the system triggers kind of a matchmaking initiation, in which he will find you a doctor basically who is the right fit for you. So we have a portrait of a coordinator, and then there is a client who is looking specifically for such kind of coordinator who can really understand their need and guide them accordingly. So this is one of the process which we are working on. Then the chatbots everyone is using, but there is a lot of personalization required. It's also in very raw format. So if you want them to be trained on medical questions, medical queries, you need to have someone with a good medical background and train those models accordingly. Of course, translation, everyone is now using it. Summaries, transcripts, we can have easily now. For example, for me, it was very difficult to check the progress of, let's say, our coordinators based on their audio conversations with the patients or with the partners. Now easily you can get a transcript of the call within few seconds, and you can even summarize it to just save more time. And there you can easily assist the progress, easily assist their knowledge. So many uses of it, and I see that there is a huge return on investment. All the areas which we just mentioned, like reducing the human resources, the time, the marketing channels can be improved and aided. So yeah, I see just only positivity.